How do I perform a breast self-exam correctly? Performing a breast self-exam is a way to become familiar with how your breasts normally look and feel, which can help you notice any unusual changes early. While some health organizations no longer recommend routine self-exams for women at average risk, because evidence shows they do not necessarily improve outcomes, being breast self-aware remains important. Women with higher risk factors should discuss with their healthcare providers about the best way to monitor their breast health. Here is a clear, step-by-step method to perform a breast self-exam safely and effectively. Start in the shower, where the skin is wet and slippery, making it easier to feel for changes. Use the pads of your 3 middle fingers on one hand to examine the opposite breast and armpit area. Move your fingers in small circles, covering the entire breast from top to bottom and side to side. Use gentle pressure for the tissue just beneath the skin, medium pressure for the middle layers, and firm pressure for the tissue near the chest wall and ribs. Be thorough and check for any new lumps, thickening, hardened knots, or other unusual changes. Repeat this process on the other breast. Next, stand in front of a mirror with your arms relaxed at your sides. Look carefully for any visible changes in the shape, size, or contour of your breasts. Watch for skin dimpling, puckering, redness, swelling, or changes in the nipples, such as inversion or discharge. Then, place your hands on your hips and press firmly to flex your chest muscles, which can make subtle changes more noticeable. Remember, slight asymmetry between breasts is normal and not usually a cause for concern. Now lie down on a flat surface. Place a pillow under your right shoulder and lift your right arm behind your head. Using the pads of your 3 middle fingers on your left hand, move in small circular motions to examine your right breast and armpit area. Use light, medium, and firm pressure to feel all layers of tissue thoroughly. Check for any lumps, thickening, or other unusual signs. Gently squeeze your nipple to look for any discharge. Repeat this process on the other side, with your right hand examining your left breast. It is best to perform this self-exam once a month, ideally a few days after your period ends when your breasts are less swollen or tender. If you are postmenopausal, choose a specific day each month to make it part of your routine. Remember, breast self-exams are not a replacement for regular mammograms or clinical exams by healthcare professionals, especially if you are at average risk. However, being familiar with your breasts helps you notice any new or unusual changes early and seek medical advice promptly. If you find a new lump, thickening, skin change, nipple alteration, or discharge, contact your healthcare provider as soon as possible for further evaluation. Women with higher risk factors, such as family history or genetic predisposition, should discuss with their doctor the most suitable screening schedule and self-monitoring practices tailored to their needs. Practicing breast self-awareness supports early detection and can be an important part of your overall health care plan. Always remember to consult your health care provider for personalized advice and regular screening recommendations.